Hi guys, hope I'm audible and you can see the screen also. So if I'm audible and you can see the screen, please send your thumbs up in the live chat. So hello everyone, this is Dr. Pritesh Singh. This is your surgery faculty, and we are going to discuss the FMG 2023 surgery questions. So let's start. Which of the following is the cause of constriction of esophagus at 25 cm from incisors, from upper incisors? So if for this, it's very easy to crack the question. There is a mnemonic known as BALD. Okay, and what's the distance from upper incisor? Here you can see 15 cm, 25 cm and 40 cm. So at 25 cm, the constriction, it is because of arch of aorta and left bronchus. So it is because of arch of aorta and left bronchus. So what is the correct answer here? The correct answer is option number B. Anybody wants to add something in this question, wants to improve the language of this question, please send your message. The same question was there. I'm waiting for your reply. Yes, Dr. Consistent, Manoj Punia, everybody is marking correct answer. Anybody wants to improve the language of question, or you want to add something in the options? Okay. So at 25 cm, the constriction is because of arch of aorta or it's because of left bronchus. Junaid, Sunsara, you want to say something? You want to add something? In option, there was many options regarding bronchus, right bronchus, main bronchus. Okay. So in options, there were many options related to right bronchus and main bronchus. Okay. Right bronchus and main bronchus. Okay, so this is first. Now you can see left bronchus, right. Now see the second one. In an admitted patient, there is sudden increase in the respiratory rate. How much? 26 per minute. So how much is the respiratory rate? It is 26 per minute. Systolic blood pressure, how much? Systolic blood pressure is 90 mmHg and GCS is 10. Okay. What will be the quick Q-SOFA score of this patient? Quick sequential organ failure assessment score. Okay. So the same question was there, or the question was like this, that which of the following is not the component of Q-SOFA? I'm waiting for your reply. The same question was there, or the question was like this, that which of the following is not the component of Q-SOFA? Meanwhile, we can discuss how to remember Q-SOFA. Q-SOFA, there is a mnemonic, what? QRS-MS. QRS-MS. So here Q means Q-SOFA, R means respiratory rate. How much? More than, it's more than 22 per minute. Systolic blood pressure, how much? More than equal to systolic blood pressure. It should be less than 100 mmHg, and there should be MS means mental state alteration. And for each score, for each one of the following, we have to give the score of 1. So, okay, Saurav Singh wants to say that कि sir component पूछा गया था all of the following except. So it's very easy question if the components are there. So components, 3 component आपको पता है, you know the 3 components. What? Respiratory rate, systolic blood pressure, mental status alteration. It's mental status alteration. Okay, you tell me what was the 4th option. Okay, Junaid, yes, lactate dehydrogenase. Very good, lactate dehydrogenase. So correct answer is this lactate dehydrogenase, because lactate dehydrogenase is not the component of Q-SOFA. So if you remember in marathon, I told you that what, there are certain scores and criteria which are important. Q-SOFA, SIRS, Bishop. So these are frequently asked question, and these are asked almost every year. So which of the following is not the component? LDH, lactate dehydrogenase. Now see, again a repeat question. This question was asked many times, and in marathon also we added this question. Same question. Which of the following is the cause of condition given below in the image? So you can see this is what, pudgy orange, and pudgy orange, it is because of involvement of subdermal lymphatics. It is because of involvement of subdermal lymphatics. So what happens? The tumor cells are going to obstruct the lymphatics, subdermal lymphatics. So what is the correct answer here? Option number A. Dr. Consistent, Richpal, Gaurav, Manoj, David, Ramesh Raja, Abhishek Singh, Ravi Stifler. Okay, so options, Ravi wants to say that sir, options were different. So tell me what were the options. For these questions, what were the options? Superficial and deep lymphatics. Okay, so one was superficial lymphatics and deep lymphatics, superficial and deep lymphatics. Okay, right. So you tell me which one will be correct here. Obviously, because there is involvement of subdermal lymphatics. So subdermal means just beneath dermis. So it is superficial or deep. So there is involvement of superficial lymphatics, so that you can see all these changes in the skin. Okay, others were artery and vein, not chest wall fixation. So superficial, deep lymphatics, artery and vein. So obviously there is involvement of superficial lymphatics, because if there is involvement of deep lymphatics, via deep lymphatics what happens? There is involvement of lymph node. So here the skin lymphatics are involved, so it is superficial lymphatics. Correct answer is superficial lymphatics. Next question, mutation in BRCA1 and BRCA2 genes should be checked in which of the following? Options: men with breast cancer, women with breast cancer diagnosed after 50 years of age, bilateral breast cancer, breast and ovarian cancer. I just want to ask, the same language was there in the question and the same options were there, or some different language was there and different options were there? I'm waiting for your reply. Utsav wants to say that except was asked. Okay, this question all except. Except. Okay. Now, you know that in BRCA1 and BRCA2 mutation, there is increased risk of what? What is the similarity in both? There is early age of onset. What? Early age of onset. Okay. Second, these patients are having bilateral breast cancer. Early age of onset, bilateral breast cancer. And third thing, what? That there is increased risk of both breast and ovarian cancer. It is breast and ovarian cancer. Now use this logic, use this data and tell me what is the correct answer in this question. Okay, Sriram wants to say that, sir, question was like genetic testing done in all except. Okay, so genetic testing for BRCA 1, 2. Genetic testing for BRCA1 and 2 genes should be done in all except. So see, there should be early age of onset. So any female in whom breast cancer is detected after 50 years of age, obviously it is excluded. BRCA1, BRCA2 both are responsible for breast cancer in both males and females. It means this is correct. The patient will be having bilateral breast cancer and there is breast and ovarian cancer. So what should be the correct answer for this question? Option number B. Option number B. Okay. So Rajendra, Balara, you got your answer? Option number B. Right? Now next question. A 4-year-old female, if you remember the same question was included in the test and discussion. 4-year-old female was brought to emergency department with complaints of accidental ingestion of coin while playing. Chest x-ray of child is given below. Which of the following will be management of this child? So first you can see on this chest x-ray PA view, what we can see, the flat surface of coin. So if you see the flat surface of coin on the PA view, it means the coin is in the esophagus. And what is the principle we follow? If the coin crosses cricopharynx, no need to remove it. It will be excreted in stool. No need to remove it. So here, are you going to perform esophagoscopy? No. On chest x-ray, you can see that it crossed cricopharynx and coin is in the esophagus. Bronchoscopy, it is required for foreign body of trachea, not of esophagus. Heimlich maneuver, no. Whenever at airway some foreign body is stuck, then we perform this Heimlich maneuver and what foreign body is coming out. So what is the correct treatment or correct option here? Wait and watch. Wait and watch. So D, doctor consistent. Okay, Ravi Stifler wants to say that, sir, lateral view was also given. In the question, lateral view was also given. Okay, so that would be obviously easy because you know this question was asked in NEET PG also, it was asked in AIMS also, and from the last 2 years continuously it is being asked in FMG exam also. So what is the correct answer here? Wait and watch. A patient came to OPD with complaints of pus discharge and pain in perianal region. Further investigation, diagnosis of fistula in ano. So what is the diagnosis here? This is fistula in ano. Okay. Now you tell me what is the first investigation done in fistula in ano. The first investigation, it is fistulogram. The first investigation is fistulogram. And you people tell me what is the gold standard investigation? I'm waiting for your reply. Yes. Vikas, Adib Khan, Bipul Kumar, Jagmohan, Dr. Hardeep Gill. Ultrasound? Ultrasound is not done. Gachi Mukesh, you are correct. Janish Bhalala, correct. Muhammad Abdul Kalam, correct. Yes, majority of you are correct. Dr. Doxycycline. So what is the gold standard investigation? Yes, the gold standard investigation, it is MRI. Gold standard investigation is MRI. So what is the correct answer here? MRI. Let me tell you, for most of the pelvic related conditions for head and neck pathologies, investigation of choice is MRI, where soft tissue involvement assessment is required. Okay, so MRI. Correct answer is MRI. Now this question, again a repeat question because similar questions were asked previously many times. Which of the following is true regarding condition in the image given below? So tell me what is the diagnosis first. I'm waiting for your reply. What is the diagnosis? All of you know that this is Fournier's gangrene. Okay. What is the other name? Idiopathic scrotal gangrene. So it is a kind of necrotizing fasciitis. What? Kind of necrotizing fasciitis. It means the structures are involved till deep fascia. So what? Skin, superficial fascia, deep fascia is involved. But structures which are located beneath deep fascia, those structures are spared. Like urethra is spared, testis is spared, cord structures, epididymis, these are spared. Okay, only scrotal skin is involved. So what is spared? Necrosis of testis? No. Testes are preserved? Yes. Testicular torsion? It's not a case of testicular torsion. Testicular cancer. So what is the correct answer here? B. Anybody wants to add something in this question or wants to improve the language of this question? I'm waiting for your reply. Manoj, Muhammad Ali, Jenish Bhalala, Amir, Saransh Khairia, Gachi Mukesh. Thank you, Nani. 143. Oh. Okay. Somebody wants to say that, sir, diabetic was there and option streptococcus was also there. Diabetic patient was diabetic. I'm asking you people. Streptococcus or staphylococcus infection is there because this infection is polymicrobial. It is caused by both aerobes and anaerobes. Options are different. Okay, Binu Radha wants to say yes, the patient was diabetic. Okay, diabetes increases the risk of Fournier's gangrene and staphylococcus was there in the option. Most common agent. Okay, in this they mentioned that most common agent is staphylococcus. Staphylococcus. Actually speaking, it is polymicrobial. Okay, Sarat Kumar, thank you very much. Junaid Sunsara wants to say that Staph aureus is only cause. So you tell me, most common agent was mentioned or it was mentioned that Staph aureus is the only cause? I'm waiting for your reply. Staph aureus is the only cause or the most common agent is Staph aureus? Okay, scrotal support is the treatment. Scrotal support is the treatment. Scrotal support is not the treatment. What is the treatment? You have to go for extensive debridement. So you have to excise the necrosed skin. Okay, most common agent. Right. So correct answer is that here testes are preserved. Scrotal support is not required. Why? Because you have to excise the scrotal skin. Clear? So correct answer is B. Next question. This question, easy question. You can see obviously it's stapler and it's linear. Circular stapler, obviously it should be circular in shape. Circular stapler is obviously circular in shape. Linear stapler is linear in shape. So this is linear stapler. It is used for anastomosis, for resection and anastomosis. So correct answer is option number A. Now next question, which of the following is the best description of the type of graft as shown in the image? So here you can see I'm harvesting the skin graft. Now can you provide some details that the skin graft was used where in the body? And in which particular area skin graft of this patient was used? I'm waiting for your reply. Kamruz Zaman, you are correct. Amir, Nihal, Sarat Kumar, everybody. Thoracoustic, Ranj, Adil Hussain, Bindu Radha, Shriram Ghost, Dr. Dive, Vatsal. Okay, Vatsal Chavda say that elbow, I think. Yes, because somebody was telling me that the graft was placed or used in the same patient near elbow. So it's very easy. See, when the tissues are used in the patient himself, means patient's own tissues are used, these are autograft. Whenever the graft is taken from same species, means mother is giving the graft to the son or daughter, it is allograft. And whenever we are taking the graft from different species, that is xenograft. And if it is taken from identical twins, that is isograft. So correct answer for this question, since the graft is being taken from the same patient, it is autograft. Okay, Tejas wants to say something. Patient graft, okay, own tissues, right. Now, which of the following is gold standard treatment for varicose vein? I'm waiting for your reply. Tell me. Initially, the treatment of choice was surgery. And which kind of surgery? Trendelenburg operation, in which we perform stripping. But nowadays, it's the endothermal ablation. What is the gold standard treatment? This is endothermal ablation. Clear? So anybody wants to add something? You want to change the option? You want to improve the language of question? Please tell me. Mayank Singh, Ghost, गुंटूर मोनिश सर ऑप्शन में स्ट्रिपिंग भी था. ओके, सो फ्लेबेक्टोमी, compression stockings, stripping and ligation. Okay, so it was stripping and ligation. Stripping and ligation. So what is the correct answer here? The correct answer is what? Thermal ablation. That is endothermal ablation. And what are the methods? One is radio frequency ablation, and the second option we have endovenous laser ablation. What are the options? Radio frequency ablation and endovenous laser ablation. Okay. Thank you Kamruz Zaman, Mayank Singh. Okay. Adil Hussain, Dr. Gaurav, Pooja, SEPS. Okay. Pooja wants to say SEPS, stripping and ligation, phlebotomy. It was SEPS, stripping and ligation, and it was phlebotomy. Okay, phlebotomy. Thank you, Pooja. Okay, no problem, Manoj. Now see the next question. A patient presented to surgery OPD with complaints of, can you see, reducible mass felt near right side of inguinal region. After further investigation, diagnosis of inguinal hernia was made. You tell me, if it is a reducible mass, it's a inguinal hernia. What kind of inguinal hernia? It is direct inguinal hernia or indirect inguinal hernia? Tell me first. Tell me everyone. Okay, Sanju, it's useful. It's useful. Why? Sanju wants to say that, sir, I'm not an FMG candidate but watching the video for NEET PG. Let me tell you, you have seen the question paper pattern. Maximum questions were there from medicine, surgery and obs and gynae. Means clinical pattern questions were there. So the similar pattern of questions will be asked in the future. Right? But no need to worry, because this is the way we are teaching in the elite plan. Okay? So no need to worry. So first you tell me, what's the diagnosis? Is the direct inguinal hernia or indirect inguinal hernia? I'm waiting for your reply. Kamar Zaman, very good Kamar Zaman. Ramiz Raza, yes. Dr. Lukman Ahmed wants to say that, sir, photo was given. Please tell me whether image was given or not. In this question, image was given or not? Image with big mass. Okay. So there was image of hernia. Image of hernia was given. Clear? So clear cut question is there that it's inguinal hernia, and if it's an adult patient, in adult patient what we go for? We go for hernioplasty. And what is hernioplasty? You know, herniotomy plus use of mesh. So herniotomy plus use of mesh. So we go for hernioplasty. Can you tell me the options? What were the options? Okay, there was cuff uncuffing, cuff impulse was there, cuff impulse was there, and it was expansile swelling. Okay, 143O wants to say, why not herniotomy? In herniotomy, what we do? We open the sac, reduce the content, excise the sac. But in herniotomy, we are not using the mesh. If you will not use the mesh, there is high risk of recurrence. Herniotomy is done in the patients up to 18 years of age. Why? Because if you are going to use mesh in the patients who are less than 18 years of age, there is growth of that patient, but there is no growth in the mesh. That's why in hernia, the gold standard treatment is hernioplasty. You have to use the mesh. Okay? Dr. Dive, sir, it was a small boy's image. If age is mentioned or if it's a small boy, means the age of patient, if in the image age of patient appears that less than 18 years, in that case, the answer would be herniatomy. So if nothing is mentioned, in that case you mark hernioplasty. And specifically, if you can see the body parts, if you can see the testis, penis, you can understand that, okay, it's a small boy. In that case, the correct answer would be what? Herniatomy. Otherwise, correct answer is hernioplasty. ओके ओवैस मोहम्मद से कि नहीं सर बड़ा आदमी था. ठीक है, अगर बड़ा आदमी था देन हर्नियोप्लास्टी, और अगर छोटा आदमी था इट मीन्स अ स्मॉल बॉय वाज देयर देन हर्नियोटमी. ओके. Next question. A 25-year-old male had met with a bike accident, was brought to the emergency department by his relatives. His vitals were pointing towards condition of shock. Urine output has decreased. Which of the following is the likely stage of shock? Now see, hypovolemic shock, there are 4 stages. Stage 1, stage 2, stage 3 and stage 4. Okay, also known as mild, moderate, severe and compensated shock. Clear? The urine output is normal in stage 1 and it's almost nil in stage 4. It starts reducing in stage 2. How much is the urine output here? 20 to 30 ml. And in stage 3 it is 5 to 15. In stage 1 it is more than 30 ml. Clear? So it starts decreasing from stage 2 or from the moderate shock. So I want to ask you, okay, Harish Nehra wants to say that it was not there. No, similar question was there. There might be straightforward question or this kind of language might be there. So I want to ask you that this kind of language was there or there was a straightforward question that in which stage of shock urine output is decreased. This kind of question. I am waiting for your reply. Vodka wants to say that it was as such. Okay, very good. Start decreasing. Very good. So this is going to help us. Urine output starts decreasing from stage 2. Urine output starts decreasing from stage 2 or from moderate shock. So what is the correct answer here? B, or stage 2. From stage 2 onwards urine output starts decreasing. So correct answer for this question is B. Next question. 67 years old male patient is a known case of testicular carcinoma. Presented to the hospital for follow-up. Which of the following lymph node is the first to be involved? Now you tell me. Most commonly involved lymph node. So here you can see this is aorta and this is the inferior vena cava. This is the testis, right testis and left testis. So this is the landing site and ultimately these are the lymph nodes which are involved. What are the lymph nodes? The lymph nodes are located in the retroperitoneum on the left side. So these are para-aortic. What are these lymph nodes? These are para-aortic lymph nodes which are involved. So question, first to be involved, not iliac, not supraclavicular, not mesenteric, para-aortic. So correct answer is option number D. Pawan wants to say that sir it was about penile cancer. But Jagmohan wants to say that it was left testis. Precaval option में था, inguinal was there, okay? So inguinal was there, inguinal. Paracaval. It was paracaval or it was paracaval or Paracaval was there? Or it was interaortocaval? Tell me. The option was interaortocaval. First question, you tell me, the testicular tumor was in the right testis or left testis? I am asking again. It was in right testis or in left testis? It was in right testis or in left testis? Now let me tell you, if the tumor is in the left testis, the primary landing site, it is primary landing site is para-aortic, and if the tumor is in right testis, the primary landing site is interaortocaval lymph node. Okay, precaval was there. Okay, so it was precaval. Precaval is not the correct answer. What is the correct answer? Para-aortic. Okay, Janish wants to say that the testicular carcinoma was in the left testis, and from left testis the primary landing site is what? Para-aortic. So what is the correct answer? It is para-aortic. Next question. A 51 years old woman presented to the hospital with complaints of mass in the right breast. Mass was movable, and after further investigation there was axillary lymph node involvement and mass more than 2 cm. So first, size of mass is more than 2 cm. So it is up to 2 cm, that is T1, and T2 is more than 2 to 5 cm. So it is T2, and there is mass in the axilla. Nothing is mentioned. Nothing is mentioned means it is not matted or fixed. If it is fixed or matted, obviously it will be provided in the question. So I assume that it's mobile. So the stage is T2 and 1, and the number is 3. 2 plus 1, it is 3. So in the videos we discussed that stage 1, 2A, 2B. And what are the numbers we are using? For stage 1 it is 1. For 2A we use number 2, and for 2B 3. So here T2 and 1, it belongs to stage 2B. Clear? This is what early invasive breast cancer. So what is the stage here? Stage 2B. Correct answer is this. And if you people have attended the question, the test and discussion session, in that we discussed a similar question. Clear? So what is the stage here? Ravikant Mishra is saying that image was also given, and Ganchi Mukesh is saying that question was wrong. Ulceration and pus exudate coming out of breast. I am asking you, was there ulceration? Ulceration was there? Ulceration was there, and image was provided in the question? Because some of the students were telling me that, sir, it was a case of inflammatory breast cancer. Why? Because in the breast there was evidence of inflammation. Redness was there. Ravikant wants to say that, sir, image was given. Ulceration, pus exudate coming out of breast image. So image was given, and there was evidence of inflammation. Evidence of inflammation. Okay, and even if there is, these things are given, then it would be inflammatory breast cancer. If similar things are given, that the patient is having evidence of inflammation involving more than 1/3 of breast skin, in that case it is inflammatory breast cancer. And what is the stage for inflammatory breast cancer? It is T4D, and T4D, it is 3B. It is 3B. So you tell me first, in the stage the same options were there or some different options were there? In the staging, the same options were there or different options were there? It was mentioned that tumor was mobile and skin was involved. Okay, so if tumor is mobile and skin is involved, So if there is involvement of breast skin involvement is there, it means what? This is T4B. Whenever there is involvement of breast skin, and even if there is involvement of breast skin T4B, it is what? Stage 3B, that is locally advanced breast cancer. Okay, Lukman Ahmed wants to say that, sir, options were T3N1, T4N1, very good. So it was T3N1M0, T4N1M0. Okay, C T3N1M0, C T4N1M0, T3N1M0 and T4N1M0. So you know that this is the clinical staging, and if this is the clinical staging, for clinical staging we are using prefix C. So since it is the clinical staging, there is involvement of breast skin and there is involvement of lymph nodes. So what is the correct answer? C T4N1M0. This is the correct answer. So correct answer here, that is C T4N1M0. So this is the clinical staging, C T4N1M0. Okay, somebody wants to say that T4B and T4D was also there. It is T4B actually if there is involvement of breast skin. This is T4B. So this is T4B. Okay, next question. Which of the following is not component of Child-Pugh score? So how to remember Child-Pugh score? The mnemonic is BAPE. What are the components? BAPE. So full form, B, that is bilirubin, A is albumin, A, it is ascites, P, that is prothrombin time or INR, and E, that is encephalopathy. E, that is encephalopathy. Clear? So which of the following is not included? Bilirubin is there, albumin is there, ascites is there, LFT is not included. So LFT, it is not the component of Child-Pugh score. Aniket, okay, 143 wants to say that total Pugh score is provided. Okay, Ansh Jindal wants to say that options were different. In one option, 4 component was there. Okay. Okay, can you send the options? In one option, albumin, globulin, creatine. Okay, albumin, globulin and creatine in one option. Okay. ascites का अलग ही ऑप्शन था. Bilirubin, thrombin. There was bilirubin, thrombin. एक ऑप्शन में सारा कंपोनेंट था. Okay, so in one option all these 5 components were there. So the question was, which of the following is correct about Child-Pugh score, or which of the following is not the component of Child-Pugh score? There was only one option. Albumin, ascites, encephalopathy. Okay, it was correct. Which of the following is correct? Right? So you can easily mark the correct answer. These are the 5 components. Whatever the option was having the correct options, you can mark. Clear? So I will frame the question accordingly. In one option, 4 options were there. So in one option, there was 4 options or 4 components were there. Right. Next question. A 36 years old female patient had recently undergone laparotomy. What will be the most common complication seen in the patient after the procedure? Now see, I'm sure that you are going to crack this exam and after that you are going for internship. Whenever you will be going for the internship in the surgery department, you will notice that after laparotomy, what is the complication? After laparotomy, what is the complication? The complication is surgical site infection. The complication is surgical site infection. Clear? So what is the correct answer here? Surgical site infection will be the correct answer. Surgical site infection. Not the rebound tenderness, not the adhesions, not the hemorrhage. Not the rebound tenderness, not the adhesions, not the hemorrhage. Clear? So it is surgical site infection. Charger, laptop.
Sir, live.
Anybody wants to add something? Anybody wants to add something? Done. Take it. Surgical site infection not there. Done. Copious serous discharge. Okay. So even if there is, very good question, if there is copious serous discharge, that is an evidence of infection. Copious serous discharge. Anybody wants to add something? Serosanguinous discharge. Very good. Serosanguinous discharge. Yes, serosanguinous discharge, it is then evidence of burst abdomen. Serosanguinous discharge. Okay. The rest of the options were same. Rebound tenderness, adhesions, hemorrhage, or you want to add something in the other options? Wound dehiscence was there, severe abdominal pain was there. There was severe abdominal pain. One was hypotension. Severe abdominal pain, hypotension. Wound dehiscence. Okay, I want to ask one simple question. Was the question like this, that in the question after laparotomy patient was having serosanguinous discharge, this is an indication of, or this suggests? Because if in the question something like serosanguinous discharge is mentioned, it is suggestive of what? Burst abdomen or wound dehiscence. Okay, Ravikant Mishra wants to say that no sir, aisa nahi tha. Okay, it's fine. So can you tell me what was the fourth option? Severe abdominal pain, hypotension, wound dehiscence. Somebody wants to say that wound dehiscence was not there. Okay, yes. Sure sign of wound dehiscence. Okay, okay. Now it's correct. Sure sign of wound dehiscence. And the sure sign of wound dehiscence, it is serosanguinous discharge. This is serosanguinous discharge. So this is the correct answer. That is actually pinkish discharge or serous discharge. So this is serosanguinous discharge. Which is the correct answer? I hope rebound tenderness was there. Rebound tenderness. So I'm repeating the question. Sure sign of wound dehiscence is serosanguinous discharge. This is the correct answer. Now see the next question. What does D stand in ABCDE? So you know that. What is A? A is airway maintenance with cervical spine protection. B is breathing, which includes oxygenation and ventilation. C means circulation. D means disability limitation or disability, in which we are going to assess GCS and pupils. So which one is the correct answer here? Disability assessment. So correct answer for this question is A. Anybody wants to add something in the question, or anybody wants to improve the language of this question? Okay, it was not related to trauma. It was PALS. Okay, it was pediatrics question, right? So let's leave it. Next, easy question. Which of the following organism is the causative agent of gas gangrene? And all of you know that gas gangrene, it is caused by Clostridium. Which one? Welchii or perfringens. The organism is Clostridium, Welchii or perfringens. Clear? So what is the correct answer here? Straightforward question. The correct answer is option number A. All of you are correct. Adil, Jenish, Phalala, Kamruz, Zaman, Manoj, Medtax. All of you are correct. Now, which of the following is the least commonly used graft in CABG? You know, what is the most preferred graft? You know, the most preferred graft is left internal mammary artery, that is LIMA. So, left internal mammary artery or LIMA is the most preferred graft. But most commonly used, that is long saphenous vein. We can use the radial artery also, but we are not using intercostal arteries. Intercostal arteries are not used. Very good, Kamruz Zaman, correct answer. Guntur Monish wants to say that this is not the question they given. So what was the question? I think the students told me that, sir, the question was, which of the following is the least commonly used conduit or least commonly used graft in CABG? The same question was there. Okay, Saqib wants to say that. Right question. Okay. Same question. So correct answer is what? D. Intercostal arteries, these are not included. Means this is least commonly used, it is not used. Next question, which of the following is not a component of Q SOFA? So we discussed a question related to this. Respiratory rate 22 per minute, SBP less than 100, pulse rate is not included. And I think somebody was saying that, sir, LDH was mentioned, lactate dehydrogenase. So lactate dehydrogenase is not the part. Okay, right. Pankaj Parikh want to say that. Guntur wants to say that I'm telling you something about gas gangrene. Tell me, Guntur, what do you want to tell us about gas gangrene question? I'm waiting. Guntur, you want to say that? You want to say something about that gas gangrene question. Tell me what? So here the correct answer is lactate dehydrogenase. Okay. Right. In gas gangrene, patient is related to army and there was crepitations. So whenever the patient is having gas gangrene, if you palpate, there is crepitations. Why? Because there is myonecrosis, there is necrosis of muscle. This is the characteristic feature. So there is presence of crepitations. Okay, I will add these 2 points. What else you want to say? Was like situation and wounded patient was there. Okay, war-like situation. There was war-like situation. War-like situation and wounded patient is there. Very good. So all these are the clues for gas gangrene, because in the gas gangrene, what? The wound should be contaminated. There should be anaerobic environment, because you know that Clostridium perfringens is anaerobe, and whenever there is gas gangrene, there is crepitations. Because of presence of gas, there is myonecrosis. So thank you very much. This was the clinical question. Next question, again a repeat question. Every year this kind of question is asked. So a 55 years old male was brought to the emergency department with history of fall from stairs. Patient has head injury. CT head was done, which is shown below. Which of the following is most likely diagnosis? So here you can see biconvex hyperdense lesion, and this biconvex hyperdense lesion, it is seen in EDH. So what is the correct answer? Yes, everybody. Nihal, Mohit, Aniket, Chavan, XYZ. Everybody wants to say it is A. Extradural hematoma. Everybody wants to say it is A. Very good. Everybody is correct. Which of the following structure of the pelvis will have recurrent hernia? So you know this recurrent hernia, it is more common in the patients who are having wide pelvis. Wide pelvis, and what kind of pelvis? Short and wide pelvis. So if the patient is having short and wide pelvis, there is increased risk of recurrent hernia. So correct answer is B. But we have to check it. We have to find the reference for this question. A patient presented with severe abdominal pain. Let me tell you, it's a repeat question. It was asked previously. Severe abdominal pain with nausea and shortness of breath. There is nausea, shortness of breath. CT was done, and here you can see what? There is aortic dissection. Can you see here? Aorta. There are two lumens. This is aortic dissection. It's an emergency situation. And what is the next best step? In this case, we should go for emergency Dacron graft repair. So what's the treatment? Emergency Dacron graft repair. So what should be done? Urgent surgery. We go for emergency Dacron graft repair. Okay, BP control plus surgery. Options for long. Can anybody tell me what were the option? One was BP control plus surgery. Nicardipine plus surgery. Okay. There was nicardipine. Nicardipine plus surgery. Okay. Then one was A and B. And what was D option? Guntur Monish wants to say hypertensive control and surgery was there. Urgent surgery was there. Okay. Give antihypertensive and send home. Give antihypertensive and send home. And there were 3 to 4 images. 3 to 4 images were there. So generally what we do in such cases, we have to go for emergency Dacron graft repair. So correct statement should be hypertensive control and emergency surgery. Okay, Pankil Parikh wants to say that wait and watch. Okay, wait and watch. Only nicardipine and send home. Only nicardipine and send home. Okay, BP control and immediate surgery. So we will draft this question accordingly. Thank you for the options. Which of the following will not have bilateral hydronephrosis? You know the concept of hydronephrosis. See, this is kidney, this is ureter, this is bladder, this is urethra, this is prostate. Whenever the obstruction is at the bladder neck level here or beyond this, in those cases there is bilateral hydronephrosis. So you know, in case of phimosis there is bilateral hydronephrosis. In case of posterior urethral valve there is bilateral hydronephrosis, and whenever there is horseshoe kidney, since kidney is fused at lower pole, in that case also sometimes there is no obstruction, but if there is obstruction both of ureters will be affected. But in ectopic ureter what happens? It is unilateral. So in cases of ectopic ureter what happens? Bilateral hydronephrosis is not seen. So correct answer for this question is option number C. Option number C. Janice Bhalala is marking most of the answer correctly. Okay, Oves Masood, one option was retrocaval ureter. So horseshoe kidney, I think it was not there. Horseshoe kidney was there, retrocaval ureter. If there is retrocaval ureter, it is on right side only. It is on right side. Then also what happens? There is unilateral hydronephrosis. Retrocaval, okay. Ectopic ureter was there or retrocaval ureter was there? Tell me. Retrocaval ureter was there, phimosis was there. Hypospadias. Hypospadias. Okay, one question was there in which there was cobra head appearance. Cobra head appearance. And this cobra head appearance is seen in which condition? Uretrocele. Anybody remembers that question? Question related to cobra head appearance? One option was urethral stricture. Horseshoe kidney was there. Okay. So retrocaval ureter, phimosis, urethral stricture, horseshoe kidney. Correct answer would be then retrocaval ureter, because retrocaval ureter is only on right side. In retrocaval ureter, hydronephrosis occurs only in the right kidney. So correct answer is retrocaval. I'm asking one question. There was one question related to cobra head appearance. What was that question? You remember? Monica wants to say that, sir, no question. Okay. Now, which of the following will be the treatment of the given condition shown in the image? So, in this image, you can see there are ureteric stones. And what is the best treatment option for ureteric stones? Obviously, we go from below and we are going to break the stone, remove the stone. This is URS. So, what is this? URS means ureteroscopy. So, correct answer for this question is C. URS or ureteroscopy. Okay, Uttam, Nitin, everybody is correct. Dr. SK, Med Talks, Ashwarya, everybody is correct. So, URS. Now, next question. CT image of a person is given below. What is the most likely diagnosis? So, here you can see kidney is fused at, you can see here, the kidney is fused. So, obviously, this is what? Horseshoe kidney. So, correct answer is B, that is horseshoe kidney. Ashok wants to say that, sir, ऐसा कोई question नहीं था. There was one question showing staghorn calculi और staghorn calculi का treatment पूछा था. I'm asking you, tell me, staghorn calculi question was there. On X-ray, there was one staghorn calculi. I'm asking you. Muhammad wants to say that, sir, same question was there. Okay, ureteric stones. Okay, fine. Which of the following is not a superior mediastinal tumor? So, what is the superior mediastinal tumor? You can see in this what we are going to include: thyroid, parathyroid, thymus. Thyroid, parathyroid, thymus. These masses are included. Okay. So, what is the correct answer here? Leukemia is not responsible for superior mediastinal tumor. So, everybody is correct. Susie Jackson wants to say that, sir, lymphoma was in option, not leukemia. Okay, it was lymphoma. Lymphoma can be present in superior mediastinal tumor, but it's not common. So, even if it's lymphoma, the correct answer would be what? Lymphoma. Lymphoma can be seen in superior mediastinum, middle mediastinum and posterior mediastinum. Clear? So, lymphoma can be seen in anterior mediastinum, but superiorly it cannot be seen. So, correct answer is here is, correct answer is what? Lymphoma. Which of the following procedure has least chances of recurrence? So, you know that there is highly selective vagotomy which is having maximum risk of recurrence, and there is truncal vagotomy which is having least risk of recurrence. So, what is the correct answer here? Correct answer here, truncal vagotomy. Raghu, correct. Everybody is correct. Okay, somebody wants to say that maximum risk of recurrence. Tell me guys, it was maximum risk of recurrence or least risk of recurrence? High risk of recurrence. So it was high recurrence but minimum morbidity. High recurrence but minimum morbidity. Now let me tell you, if there is high recurrence and minimum morbidity, it is highly selective egotomy. And if there is low recurrence, with maximum morbidity, this is seen in truncal vagotomy. So in that case, the correct answer would be highly selective egotomy. High recurrence, minimum morbidity, then correct answer would be highly selective egotomy. Okay, high recurrence. Which of the following feature is most commonly seen in all types of shock? What is the definition of shock? It is the syndrome caused by inadequate tissue perfusion. What? Syndrome caused by inadequate tissue perfusion. So what is common to all types of shock? Yes, decrease in tissue perfusion. So the correct answer is A. Now question number 54. You tell me what is the correct answer. In question number 54. A 54-year-old male presented to surgery OPD with complaints of, can you see, white lesion developed between gingiva and buccal mucosa and gingiva. He had history of chewing tobacco for more than 30 years. What can be done? So here the tumor is arising from alveobuccal complex, and in this case what you have to go for? Go for biopsy. So what we go for? Local excision and biopsy. So correct answer is, first you have to confirm the diagnosis. So go for local excision and biopsy. Jenish Bhalala, Aishwarya, Varun Goyal, Guntur, Jagmohan Jangid. Jagmohan Jangid wants to say that submucous fibrosis hai sir. This is not submucous fibrosis. In submucous fibrosis what happens? It is more common in first females. And what happens? There is involvement of submucosa of oral cavity. These females are not able to open their mouth. They have history of beetle chewing for long period. So this is growth or tumor arising from alveobuccal complex, and the correct answer here A. 55-year-old female patient diagnosed with papillary carcinoma thyroid visited you for second opinion after undergoing a total thyroidectomy. What will you do regarding the same? Now see the problem. Whenever a patient is having papillary carcinoma thyroid, total thyroidectomy is done. In the post-operative period, we have to go for what? Thyroxine suppression, and then we go for whole body scan. So after thyroxine suppression, we go for whole body scan, means we use radioactive iodine in well differentiated thyroid cancer. So it is not radiotherapy, it is not chemotherapy, it is not only follow up. What is the correct answer? डॉक्टर अशोक wants to say सर क्वेश्चन गलत बता रहे हो, प्लीज सुन लो. हाँ अशोक, पहले आप बोल लीजिए. फर्स्ट यू टेल मी, बताइए व्हाट वाज द क्वेश्चन. Monica Ramesh wants to say that sir, there was leukoplakia white patch. 7-month smoking history was there, trichloric acid. Okay, even if अगर हम ये वाला, if you want to see this question, even if there is leukoplakia, right? So what you have to do basically, first you have to confirm. Don't worry, I will frame the question according to the chat. So I will read all of your chats carefully, and then only I will frame the question. Okay. So even if there is leukoplakia, in that case also what we have to go for? Confirmation. Right. So dream big, 7 months history with white patch. Okay. There was 7 months history. 7 months history with white patch and there was leukoplekia for 6 months. ठीक है अशोक. Electrocoagulation with some solution. Electrocoagulation. ठीक है. Okay अशोक, thank you. Avoid tobacco, not to worry. एक ऑप्शन था avoid tobacco and not to worry. Now you tell me, what is the definition of leukoplakia? The whitish patch which cannot be given any other name. So that's why you have to do the biopsy, see the changes, and then only we are going to label it as leukoplakia. So answer remains same. I will include all these changes, Ashok. Thank you very much. Electrocautery was there. Okay, electrocautery. Electrocautery. Yes, very good. Varun wants to say that we want to rule out dysplasia. Very good, because we have to rule out the risk of malignancy. Dysplasia, yes. Okay, Pilvan Akhil, please explain in Telugu. Dear, I don't understand, and I'm not, actually I can't speak. Yes, I can speak Bhojpuri. No, I don't know Telugu. Only I know salt, uppu in Telugu. That's it. Okay, now come back. Come back to the question. So, in a patient with history of kidney stones, painful bones, abdominal groans, psychic moans, fatigue overtones, which of the following investigation is used for diagnosis? Now you tell me. I'm from UP. I'm from Mirzapur, so be careful. Okay? Right. So I want to ask that in this question, you want to add something about the language, or you want to add something in the options? Ashok? System review, this question was there or not? Okay, yes, it was there. Ultrasound neck was there. CT scan, MRI, okay. Ultrasound neck was there. CT and MRI. So whenever a patient is having kidney stones or symptoms similar to this, okay, X-ray hand was given. X-ray hand. See, actually, it's very difficult to recall the questions, because the students, when you are sitting in the exam, yes, you are already stressed. So what you understand, you remember the core value of the question. You don't remember the exact language. So anybody who helped me in the question, I really thank you, because you told me the core of the question, then we can do the modification. So Ashok, what you tell me, what's your suggestion? What was the language? Okay, yes, there was one X-ray in which brown tumor was there, or in one of the phalanx, what happens, there was swelling. So there was brown tumor. It is suggestive of what? Hyperparathyroidism. So if we are suspecting primary hyperparathyroidism, in primary hyperparathyroidism, the cause is solitary adenoma of parathyroid, and parathyroid adenoma is detected by technetium 99 cysta-MEB scan. Okay, so hyperparathyroidism history was there. Okay, brown tumor in little finger, right? So I will do the modification, and whenever we suspect adenoma, you know that for parathyroid localization, the gold standard or the best investigation is cysta-MEB scan. Now next question. A homosexual man complains of painful defecation and prolapsing mass from anus. Doesn't reduce, has foul smelling discharge. On examination, cauliflower-like mass. Biopsy, squamous cell carcinoma. Which of the following is preferred treatment option? Ashok, tell me, this was the question, exact language, or you want to do some kind of modification? Pawan wants to say that, sir, this question was there. Okay, so you can see homosexual It's a risk factor for squamous cell carcinoma of anal canal. Another clue that there is cauliflower-like growth, it is not reducing, there is foul smelling discharge. And what is the treatment? For this, we go for Nigro regimen. The treatment is Nigro regimen. Clear? And what is this Nigro regimen? It is chemoradiation. So correct answer for this question is the Nigro regimen, that is chemoradiation. Somebody wants to say wide local excision. Wide local excision. We don't go for excision. First we go for chemoradiation. Okay. Next question. A baby was brought to the emergency on second day of birth with excessive frothing and respiratory distress. X-ray is given below. What is the diagnosis? The same question was there or some different question was there? Nigro regimen was there, APR was there, chemotherapy was there, wide local excision was there. Okay, right, this is, I think this is not related to surgery, so let's skip the question. This condition is due to non-fusion of, tell me what is the name? This is cleft lip. Can you see here? There is cleft in the lip, cleft lip. And what happens? You can see here, this is maxillary process and this is medial nasal process. So what happens? The cleft lip is because of non-fusion of maxillary process and medial nasal process. Okay, so correct answer is option number A. Mohit Patel, Aniket Chavan, Sanket Pathak, all of you are correct. Correct answer is here, option number A. Another question, timing of repair of cleft lip, cleft palate. This was asked in exam or it was not asked? Because only 2-3 students told me that sir this question was asked. Okay, it was not asked. Right, so I hope only cleft lip question was asked. A diabetic patient developed deep venous thrombosis with necrolytic erythema migrans. What is the most likely cause? Ashok, do you want to add something in the language and in the option? Tell me. I'm looking for. Muhammad Rafiq wants to say, sir, this question was there. Please tell me, you remember something else? Glucagonoma was there. Gastrinoma was there in the option. There was gastrinoma, insulinoma was there. Tell me. There was hyperglycemia. In the question, there was patient was having hyperglycemia. Okay. Daily cloudy, don't worry, we are not going to skip any question. The questions which are not related to surgery, only we are skipping those questions, so don't worry. Okay, Neeti wants to say that insulinoma. Yes, it's a repeat question. And what was the fourth option? Somatostatinoma. Somatostatinoma. So you know that glucagonoma, it is also known as 4D syndrome. And what are the components of 4D? Diabetes mellitus, DVT, it is dermatitis and depression. Diabetes mellitus, DVT, dermatitis, depression. Dermatitis, this is the most common symptom and the name of that symptom is necrolytic erythema migrans. So correct answer is glucagonoma. Okay. Now next question. There was an image showing capillary hemangioma, cavernous hemangioma. Anybody remembers this question? Waiting for your reply. There was one baby image with hemangioma. Which part of body was there? Okay, it was in the face. Okay, capillary hemangioma was there in the face near eye, near upper eyelid. Can you tell me what about the other options? Port wine stain? Other options for port wine stain? Tell me. Port wine hemangioma. Okay, port wine hemangioma. Macular stain was there in the option. Navi Agarwal wants to say that varices was there. Varices. Varices was there in the option. Port wine hemangioma, varices, herpes simplex. Okay. Herpes simplex. Okay. Herpes simplex. No port wine. So what was there? Capillary hemangioma. Yes, this is the correct answer. Okay. Some students were telling me that, sir, there was one question related to bladder cancer and intravesical chemotherapy was mentioned, MVAC, something like this was mentioned, methotrexate, vincristine, adriamycin, cisplatin. Susi Jackson wants to say that yes, sir, this question was there. Susi, Navi Agarwal, can you please help me in this question, informing the language of this particular question? Okay, BCG was mentioned. BCG, bladder cancer invading muscle layer. Very good. What is the name? Pankil Parikh. Very good. Pankil Parikh, bladder cancer invading muscle layer. It was bladder cancer invading muscle layer and the treatment. Very good, Pankil. Invading muscle layer. What is the treatment? BCG and mitomycin C. BCG, mitomycin C. Some surgery was there. Intravesical BCG. Okay. It was, you people are genius actually. Intravesical BCG and radical cystectomy was there. Radical cystectomy. So actually speaking, whenever the bladder cancer is invading muscle layer, we have to go for radical cystectomy. Mukul Muhammad Rafiq wants to say that cystoprostatectomy. Tell me, it was radical cystectomy or cystoprostatectomy? It was radical cystectomy or cystoprostatectomy? Old patient. Old patient. Patient was smoker or not? Okay. It was cystoprostatectomy. Cysto. So okay, we will go for cystoprostatectomy. Patient was old. Patient was smoker or not? Okay, smoking was not mentioned. Okay, cystoprostatectomy. Very good. So everyone wants to say that cystoprostatectomy was there. So this is the correct answer. Cystoprostatectomy, in which even we remove the prostate also. Next question. Please tell me what was the question related to Burgess disease. 70 years old chronic smoker, image of distal phalanx was given. So in distal phalanx there was gangrene. I'm asking you people, tell me. There was gangrene. Sanket Pathak wants to say that, sir, image based question tha, foot image was there. It was the foot image showing gangrene. Okay, very good, very nice. Everybody wants to say that. Now, can you tell me what were the options? coronary artery disease patient, CAD patient, Burgess disease one option, Raynaud's, okay, Raynaud's disease. What was the third option? Giant cell arteritis, atherosclerosis. Now you tell me what is the correct answer. Giant cell arteritis and atherosclerosis. Yes? Right. Now here, you tell me what is the correct answer. See, for Burgess disease, the patient age should be less than 40 years. So it is exclusively seen in males, smokers, less than 40 years. Atherosclerosis, it is seen in 6th to 7th decade. And if we see, for peripheral arterial occlusion, what is the most common cause? The most common cause is actually atherosclerosis. So the clue is what? Age. Age is the biggest clue. Patient was having cardiac problem also. Very good. So coronary artery disease, it means again atherosclerosis. So what is the correct answer here? The correct answer would be atherosclerosis. Because patient was having coronary artery disease, patient was 70 years old. Very good, Pawan, very good. Pawan wants to say that, sir, मैंने पहले Burgess mark किया. After that, I saw the age and then I marked atherosclerosis. Very good. Okay. So see, Burgess, what are the clues for Burgess? Burgess के लिए, it is exclusively seen in males, smokers and age. Very important, less than 40. If we see worldwide, most common cause of peripheral arterial occlusion, it is atherosclerosis. The most common cause is atherosclerosis. And atherosclerosis, it is seen in 6th to 7th decade. So 70 years itself indicate that what? Patient is having atherosclerosis. Adil Hussain wants to say, sir, 100% Burgess था. बिल्कुल भी नहीं. 70 years old patient, if he is having coronary artery disease, it's not Burgess. It is atherosclerosis. The gangrene will be similar. They will be peripheral arterial occlusion, so they will be gangrene even in atherosclerosis. Right? Smoking, yes, smoking and alcohol, both of these are risk factor for atherosclerosis. Age and coronary artery disease. Correct answer is, it is atherosclerosis. Next, increased tone of LES. Yes. Now what happens? Nitric oxide, it is responsible for LES relaxation. Okay. And acetylcholine, this is responsible for LES contraction. Right. So if you decrease acetylcholine, what will happen? There is relaxation. And if you decrease nitric oxide, there is no relaxation. And if there is no relaxation, if there is decreased nitric oxide, what will happen? There will be increased LES tone. So decreased nitric oxide will lead to increased LES tone. So what is the correct answer here? Correct answer would be C. Decreased nitric oxide. Naimish Gautam wants to say that, sir, both left bronchus and arch of aorta were given as a separate option. Please now tell me the better option. उन दोनों में then better option will be left bronchus. Okay, one question was like first to be done in BPH, option was prazosin, rest I don't remember. Shivam wants to say, anybody remembers any question related to BPH? I'm waiting for your reply. You remember any question related to BPH in which we give prazosin? Satish Kumar wants to say Q so far. Yes, please tell me. Restriction of water intake, okay? One option was restriction of water intake. Restriction of water intake. What else? First management. Muhammad Rafiq wants to say that TURP was mentioned. TURP. Alpha blocker. One question was BPH causing urinary symptoms. First to do. BPH causing urinary symptoms. First to do. First to do. Initial treatment. Okay, it was discussed in pharma. By the way, the initial treatment in patients, we have to start what? Alpha blockers. That is the initial treatment. Next question, surgical treatment of full thickness rectal prolapse. Rectal prolapse question was there or not? Because I think somebody confused this question with that question of squamous cell carcinoma, anal canal. No? Okay, everybody wants to say that this question was not there, right? All of the following are correct about neuroblastoma except. Let me tell you, in majority of malignancies which are out of GIT, the metastasis occurs in the lungs. So most common site of metastasis, generally it is lungs. What is the problem in neuroblastoma? It metastasizes to long bones. Pulmonary metastasis, it's rare. This is characteristic feature of neuroblastoma, that pulmonary metastasis is rare. So there can be lymphatic spread. Initially we give chemotherapy, then we do the surgery, and it is the most common intra-abdominal malignancy in children. So what is the correct answer here? Correct answer is B. Utsav Brar, Sonia Ghosh, they want to say that nephroblastoma was asked. It was neuroblastoma or nephroblastoma? Okay, now let's change. It is nephroblastoma. And if it is nephroblastoma, means it is Wilms tumor. In nephroblastoma, it's Wilms tumor. So this is not the... Okay, second question, not correct. Correct or incorrect was there? It was correct or incorrect? Let me tell you, Wilms tumor. In Wilms tumor, there is pulmonary metastasis. And in the treatment, we go for radical nephrectomy. So in a majority of cases, no need to go for chemotherapy followed by surgery. And this is not the most common intra-abdominal malignancy. It is the second most common intra-abdominal malignancy. Okay, incorrect. So almost all options are incorrect. Only lung metastasis are one, chemotherapy with, then surgery. Metastasis occurs to lung. Okay. Spread was asked. There is hematogenous spread. There is hematogenous spread, not the lymphatic spread. There is pulmonary metastasis. So hematogenous spread is there. There is pulmonary metastasis. In the treatment, we can use chemotherapy followed by surgery. This is not the most common intra-abdominal malignancy. It is second most common. It is second most common. Okay, lymphatic spread was there. Okay, lymphatic spread can be seen. Yes, it can be seen, but the most common route of spread is hematogenous. ठीक है. Then the answer would be most common intra-abdominal malignancy in children, because it's a neuroblastoma which is the most common intra-abdominal malignancy. Correct answer would be D. I will frame the question according to your messages. Which of the following is true about congenital hypertrophic pyloric stenosis? It presents with non-bilious vomiting. Yes. Ultrasound is 100% sensitive. It's not. Caused by hypertrophy of circular muscle fibers, not the longitudinal. Can you tell me what was the fourth option? Okay, not true. So it is caused by hypertrophy of circular muscle fibers, not the longitudinal. Okay, in the question, the child was having projectile vomiting. Child was having projectile vomiting. Hypochloremic metabolic alkalosis. Okay, then the correct answer will be, if we have to choose the best one, it is caused by hypertrophy of longitudinal muscle fibers, because it is not caused by hypertrophy of longitudinal, it is caused by hypertrophy of circular muscle fibers. Okay. See, her ultrasound is not 100% sensitive, but ultrasound is the investigation of choice for diagnosis. Clear? It is investigation of choice. So it's not completely incorrect, but C is completely incorrect. So we have to prefer option number C. 4 patients came to hospital after trauma. Point out correctly matched one. First you tell me, this question was there in the exam or not? In extradural hematoma, pinpoint pupil, penetrating trauma to eustachian tube, there is CSF photoria. Penetrating trauma to eye, there is battle sign and mastoid, something like that. Yes, Nitin, yes, everybody wants to say that yes, this question was there. Option was wrong. Okay, Susi Jackson, can you tell me the option? Saurabh Singh, mastoid, can you tell me the options? Gaze, paresis, midbrain. Means it is something related to medicine. What was the last option? Okay, it was ENT question. Okay. Cranial nerve, okay, so it will be discussed either in ENT or medicine. Next question, alcoholic patient presents with epigastric pain radiating to back, so you can make out the diagnosis. Amylase was raised. What is the diagnosis? In the question, value of amylase was given, raised value. So obviously it is acute pancreatitis. Can you tell me what were the other options? Daily Cloudy wants to say, sir, ये question था. Yes, this question was there. Chronic hepatitis, okay. One was chronic hepatitis. What were the other options? Appendicitis, viral hepatitis. Appendicitis, and there was viral hepatitis. Fatty liver was also there. So chronic hepatitis was there or viral hepatitis was there? It was chronic hepatitis or viral hepatitis, tell me. No appendicitis, okay. So here fatty liver was there, okay. Fatty liver. Obviously correct answer is acute pancreatitis. Next question, patient is having severe headache. He has never felt a headache like this. No history of fever. Non-hypertensive and non-diabetic. Nuchal rigidity was present. Most likely diagnosis, you know that the subarachnoid hemorrhage leads to the headache, which is described as the worst headache of life. So what is the correct answer here? Subarachnoid hemorrhage. Can you tell me? Okay, last option was EDH. Thank you. Rushda Parveen. Thank you, Rushda. Encephalitis was also there. So migraine was there or not? El Nino polytrauma. Polytrauma question it will be discussed in medicine or ENT. Migraine was there. EDH was not there. There was encephalitis. Okay. So there was encephalitis. Right. Correct answer is subarachnoid hemorrhage. Now, most important risk factor for acute mastitis. So you know that in lactating females there is breast abscess or inflammation mastitis. Why? Because of faulty breastfeeding technique there is trauma around the nipple. So what happens? Cracked nipple and Staph aureus enters inside, is responsible for abscess. So what's the cause? It is cracked nipple. So correct answer is cracked nipple. Failure of lactation or lactation failure? Lactation failure. Okay. Anybody wants to add something? Correct answer is B. Barium image of intestine was mentioned. And I think duodenum was marked. Something image was something like this. And this part was marked. So I think it was duodenum. Thank you, Pawan. It was duodenum. Okay, so it will be discussed in radio and I will recall, I will get the image and then again I will be discussing this again. Most common indication for splenectomy. There was one question related to splenectomy and options were ITP and G6PD. First you tell me this question was there or not, and if yes, what were the options and what was the language? Rishi Maurya wants to say pylorus. It depends on the image. It might be pylorus also, and if it is the raised portion, that raised portion is duodenal cap. That is the first part of duodenum. Hereditary spherocytosis, okay. There is one option, hereditary spherocytosis. Hereditary spherocytosis. ITP. Hairy cell leukemia, okay. Hairy cell leukemia. All of you know that the correct answer is what? The correct answer is ITP. Idiopathic or immune thrombocytopenic purpura. So this is ITP, that's the correct answer. Okay. Now, if there is change in the language of the question, if the question is like this, that hemolytic anemia, which of the following hemolytic anemia is the most common indication, then the answer would be hereditary spherocytosis. No, most common indication of splenectomy, it is not hereditary spherocytosis, it is ITP. It is ITP. Next question. Pheochromocytoma, palpitation, headache, typhoresis. There was something like this question related to pheochromocytoma. Anybody remembers that question? Muhammad Shabazz wants to say that hemolytic anemia was mentioned. So I'm telling you, if it is straightforward question, that most common indication of splenectomy, it is ITP. But if the question is like that, the hemolytic anemia, in hemolytic anemia patient, what is the most common indication? Then the answer would be hereditary spherocytosis, right? So everything depends on the language of the question. Anybody remembers this question? Episodic headache, option has pheochromocytoma, okay? In the option there was pheochromocytoma, patient was having episodic headache and 34 years old male. What would you suspect? Okay, 34 years old male, presents with this, what would you suspect? Then pheochromocytoma. What were the other options? Hypertension, diaphoresis. What were the other options apart from pheochromocytoma? Options. One option was pheochromocytoma, that's the correct. What were the other options? Chronic migraine, okay. It was chronic migraine, right. What were the other options? Adrenal cancer, okay. Fourth option, anybody remembers fourth option? Fourth option, yes, guys, I'm waiting. What was the fourth option? Tell me. Adrenal cortex tumor. Okay, pheochromocytoma, you know that this is arising from adrenal medulla. Adrenal cortex tumor. Okay, so correct answer is A, that is pheochromocytoma. There was one question related to brain tumor. The female patient was there, and in option glioma, semoma body, something like that was mentioned. Yes, it is meningioma. Dural tail sign was there. Tumor arising from dura. Dural tail. There was dural tail sign. In option there was meningioma. Pseudotumor cerebri. Tumor has calcium whorls, okay. Tumor has calcium whorls, okay, that is semoma bodies. Calcium whorls, semoma bodies. Semoma body was there in the option, okay. Meningioma was not there in the option. Meningioma was not there in the option. Only semoma bodies were there, okay. Pseudotumor cerebri. And what were the other options? Tumor having semoma bodies. Anybody remembers the fourth option? There was one option, glioma. What was the fourth option? Patient was having headache also. Friday appearance. Semoma body with whorls pattern. Semoma body with whorls pattern, fried egg appearance. Anybody remembers the other option? Onion skin. Onion skin. With Semoma body. Okay. Clear. So generally there is Semoma body with whorls in meningioma. Now question number next question. 40 years old female presented to pain in left flank and hypochondrium. There was 3 centimeter mass which was ballotable on inspiration. On urine examination, malignant cells were seen. What will be the next line of management? First tell me this question was there or not. This option was there or not? This question was there or not? Okay, it was 4 centimeter mass. Okay, 4 centimeter mass. Yes, question was there. Anybody wants to do some kind of modification in the language of the question? And please tell me the options. Radical nephrectomy, very good. Radical nephrectomy. Unilateral nephrectomy. Yes, that's radical. Intravesical BCG with chemoradiation. No. Okay. Intravesical BCG followed by chemoradiation. Now you can see this patient is having 4 centimeter tumor in the left kidney. And what is the preferred approach here? We will go for nephron sparing surgery, also known as partial nephrectomy. No need to go for radical nephrectomy. So what is the preferred treatment option here? The preferred is what? Removal of left calyces and its attachment. So we will go for partial nephrectomy. Option was do DTPA scan. This option was there. DTPA scan was there. Okay. So DTPA scan was there. So next best line of treatment is in these patients we have to assess the kidney function, and in the management we have to go for what? Partial nephrectomy. साजिद wants to say सर ऐसा क्वेश्चन नहीं था, DMS से somebody wants to say. DMS से नहीं होगा, most probably it's DTPA scan. Okay. Any other radiological feature was there? That ultrasound was done. Removal of calyx was not there. Anybody remembers the B option? What kind of surgery was done? Radical nephrectomy was there. Intravesical BCG was there. Anybody remembers the surgery option? B option was not sure. Partial nephrectomy option nahi tha. Removal of calyx was not there. B option, everybody is saying that. B option was not there. If B option is not there, okay, left side kidney removal. See if, but Lakshman wants to say partial nephrectomy was there. Partial nephrectomy. Now let me tell you, whenever we are planning to do nephrectomy in any patient, whenever we are planning, always we have to check the function in contralateral kidney. So that's why we have to go for DTPA scan. If nothing is mentioned in the exam that CT was done or not, then first we go for DTPA scan. We have to assess the function in the kidney and then we will plan the surgery. Somebody say that no partial nephrectomy, it was removal of cyst with envelope or capsule. It was removal of cyst with capsule. Okay. So if similar options were there, then we would go for what? DTPA scan, because you have to assess the kidney function and then plan the surgery. Okay. So answer will depend on the language and the options. No partial nephrectomy. Okay. Apart from these questions, anybody remembers any other question related to surgery? Any other question related to surgery? Yes? Next line will be DTPA. Yes, Siddharth, it will be DTPA. There was painless hematuria. Yes, there is painless hematuria. Painless hematuria is more suggestive of CA bladder, but ballotable mass, that is suggestive of 70 years old male with Cushing syndrome. Most common causes steroid intake. Q SOFA, it was covered, or ectopic hormone production. Gas box syndrome, that is covered in physiology. Okay, Q SOFA we covered. Any other question you remember? Regarding CABG, most preferred, that is Lima. Most commonly used, that is long saphenous vein. We use radial artery also. Sir, एक catheter था, Pipel catheter, it is for endometrial aspiration, that is used in gynae. Manubrium is T4, that is one instrument image we discussed, that is linear stapler. Cushing and ACTH, yes, covered. Fourniers gangrene is also covered. Thank you, Ashok. Stapler is covered. Okay. So thank you guys. Thank you very much. This is my email ID which I am sharing with you people. If you remember any other question, or if you are going to get any image, please send me those images on the Gmail, right? And I will record the lecture, I will record the video soon, and we will upload it on app. So I want to tell you something about this Elite pack, and the offer is going on, that the new video lectures of all 19 subjects are included, and it is provided obviously in both English and English format. And check the new Q bank, it's awesome, you just check it. Apart from that, obviously you will be getting the notes, there is treasures, you will be getting rapid revision and snapshot videos. The mock test will be according to the latest next pattern. And past year questions, we have discussed past year questions of FMG, NEET, PG, INI-CET, everything is discussed. Clear? So guys, this offer is running, go for it, and best of luck for the exam. Take some rest, relax. Definitely you're going to crack this exam. Okay, so best of luck. थोड़ा वेट कर लो.